in the industry that we're in, healthcare or in IT, there are usually words that come out that have big, big meanings. 15 years ago, the word cloud first came out and it meant everything under the sun. It was hard to define, hard to put your finger on it. And I think patient experience is one of those big words that is our industry and that convergence of healthcare and IT. So what I'd like to do is take a few seconds now, Reese, if you don't mind pulling up a poll so we can just gather a little information from our team that's with us today. So we take a few seconds to go through and do this.
Yes, so you guys should see the poll up right now. Do you see it?
Yes.
Okay. Oh, shoot, hold on. Let me finish this 1 second. I think it is not allowing you to. Okay, if you could keep going, give me one moment for some technical difficulties.
No worries. Technology is great, but it doesn't always work the way we want it to. So what I want to do is I want to start with this concept of perspective. What does it take to really be able to drive changes in the healthcare industry to create a new and unique patient experience? And I believe the first step in doing this is changing the perspective. And as we talk about changing perspective, it really comes down to three key things I look at. The first thing I think that's happened in the industry is that for so long, we talk about patient experience. We put a lot of the onus on the doctors themselves, trying to get doctors to change and transform the way they deliver services to create a better patient experience. But fundamentally, I believe that we need to change the perception or perspective of how we do this and focus more on the support structure that's built around the doctors and the practice and the healthcare centers to be able to deliver the patient experience that we want. The second thing that I think we really want to do is that we really kind of have to understand that what are the expectations of the patient is. I think if we look at the online world and what we've seen in the online world over the last 20, 25 years, our expectations have changed as consumers, whether consumers of purchasing books or items off Amazon or purchasing and consuming healthcare solutions, right? People are so accustomed today, the one-click purchase and 2 hours later a product shows up at your house. They're starting to expect the same thing in the healthcare industry. And the third thing that I think is really important is that we have to change our perspectives as organizations. We really truly want to deliver a new patient experience. It starts with us starting at the top of the organization, defining our North Star, defining what the patient experience needs to look like, what the purpose, what the vision, what the values are, the models, the methodologies we want to deliver that patient experience. So it looks like you're back, Rissa, so maybe we can jump in and do the poll again.
Yes, please.
Much better now.
Nothing like technical difficulties on a technical webinar here, but thank you for giving me an extra moment. So this is our poll for you all. We would love if you could help answer these questions. So on a scale of 1 to 5, do you think your organization is doing enough to create the ultimate patient experience? And this is anonymous, so don't worry, you can be honest here. Question number 2, are you leveraging technology currently? I would assume everyone is, but you never know. Number 3, how important are technology goals for your organization? I guess Charles won't take this personally as a CIO. And how did you find out about this webinar? Sorry, this is a sneak question for me, so I can help make sure that we get it in front of the right people in the future. And then lastly, who are you? Just so we can make sure that we're speaking your language and that we are supporting you for this webinar. So anyone else want to partake in this webinar? I'll give you 10 more seconds to get your answers in here. A little elevator music. All right, I'm going to end the poll. Some people are being shy, but we still have some good results. Can you see them, Tim?
Yes, I can. So I'm just going to focus on the first one for right now. The first one was basically, do you think your organization is doing enough to create the ultimate patient experience? And what we're seeing is that predominantly the most responses here are there's room for improvement. There's a few that are not sure, relatively neutral. From this, what we can tell just from the people in this audience, that there is definitely room for improvement. For the most part, some people think they're doing a decent job, but there's still a lot of room to change that experience. So what I like to do is kind of start in with the kind of the Q&A question with our team here. I'd like to direct the first question that I'd like to discuss for a few seconds is to Kevin. Kevin and I have known each other for about 15 years. We've been, deeply entrenched in the technology industry, helping businesses transform the way they do business and conduct business. Kevin, we've got ourselves reacquainted with that kind of from a new perspective. It's no longer around technology, but it's more around the patient experience. When we first talked, when we were putting this webinar together, I had read an article that you talked about the patient experience and what needs to be done to change that. Can you kind of share with the group here a little bit, what put you on this journey to focus from technology to patient experience?
It's a good question, thanks. So for me, my journey began that I was in a situation where on a whim, I found out that I was on a very near term, highly probable fatal cardiac event that could happen at any moment. So all of a sudden I'm rushed into the healthcare system. They perform this major surgery on me. I live, and what began to happen is I started to observe all of the little things that a number of selfless, caring individuals are doing, not just the doctors and the nurses, but the lab technicians, the food service people, the janitorial services. I mean, I was amazed at what happened. And it occurred to me that what was going on is that my value and relevance and importance as a human being was being highly affirmed. And it caused me to want to give back. It caused me to start a twice-a-day cardio exercise program, take my meds, eat right, work on my stress, et cetera. And I really wanted to demonstrate to healthcare what they do, why they matter, and the difference they make. So I started on this track of writing articles. I've been doing speaking, and that's what caused it. And what I talk about is, what does great patient experience look like, or how is it achieved from the perspective of the patient?
That's awesome. Well, first of all, I'm glad that you were rushed to the hospital and you got it taken care of, or you wouldn't be here with us today. So I'm glad you followed the care package that you got put together well. So I'd like to get into the real first question about this, building off what you said. Obviously we're here to talk about the patient experience. I just kind of like to get a kind of idea where we see how important the patient experience is for the future of healthcare. Right now, we have a pretty decent healthcare system, and we're talking about improving this. How important is it, and why is that? So, Charles, you're knee deep in this every day. You're dealing with this. You're probably talking about this 3, 4, 5, 10 times a day. Kind of, how would you kind of start this conversation?
Well, thanks for the question, Tim. I don't think we have a great healthcare system, by the way. I think not for many people. One caveat is I want the audience to know that I do work in the safety net. Many of our patients it's an outpatient facility, and we serve folks that are underserved. There's a lot of forces at work that are putting more and more focus on the patient. I think there's a shift from a top-down delivery system where folks simply receive their care. There's a movement afoot for people to actually claim their healthcare. I think technology plays a role in that for them to become more involved in their care and raise their health literacy. The expansion of the Affordable Care Act, at least in the safety net, has made this more competitive than it's ever been. And so if you don't take care of your patients, they can vote with their feet and find some place to go that's doing it a little bit better. So you can't take anything for granted any longer. You really do have to focus on their experience. Finally, I think you have to meet the patients where they are. They're going to have different standards for what they determine to be excellent care. Some people want to be seen. They don't want anybody to waste their time. There's other people that are going to need that TLC that was mentioned earlier. So,
Charles, just a quick follow-up to that. You said meet the patient where they're at. Do you believe that patient where they're at changes based upon what's needed? If a regular routine checkup or follow-up, maybe their expectations are different versus dealing with something like Kevin went through. Do you think that changes depending on the circumstance?
Well, absolutely, no question about it. I think, when we look at our texting campaigns and things like that, where we're doing outreach for population health and whatnot, there's a certain demographic that's engaging, statistically more than others. These are folks that are otherwise relatively healthy. A lot of their care can be managed remotely. They don't necessarily need to be seen by a provider. They could be seen by a support staff to get them tucked in. Conversely, you have other folks that are managing a lot of comorbid conditions, and that can be really scary. And coming into the health center and having that personal connection is important to them. It's important to their treatment process.
Excellent. Steve, just kind of follow up with this. I mean, obviously, as this healthcare system is evolving, technology is playing a key role. I think a lot of us remember, 10, 15 years ago before the ACA, there were still a lot of practices and doctor's offices out there that didn't have electronic medical records and, and systems. So how do you see that changing now and going forward?
Well, that's a good question, Tim. The industry is obviously changing overnight with COVID. I read a quote from the professor of medicine up in San Francisco and said, we changed 20 years in 20 days with the telemedicine emphasis. So what we're seeing is a big push towards technology, and it's driven off of not only things like COVID, but obviously we've got employment challenges in the healthcare space. We've got payer mechanisms that are competing with our interests, and we've got to be able to leverage technology to take out some redundant tasks in healthcare, but we can't miss that human element and human touch when it comes to patient experience. So when you look at how you're going to adopt, say, a patient engagement technology to hopefully improve the patient experience, you really have to look at your patients and understand where they are in their technology acumen. I mean, today, and I think Charles mentioned it, 20% of the US families don't have internet at home. So we have to understand our audience before we launch into these programs. So I always encourage clinics as they start to look at chronic care management, online scheduling, online bill pay, remote patient management is some of the more popular technology options out there to really improve that experience. Is understand your customers, look at your specialty, and as Charles said, meet them where they need to be. If it's somewhat of an annual visit, a checkup, things like that can be managed through some online presence. But as you mentioned, if they're chronic disease patients, as a lot of our senior citizens are, they're going to need more interaction, and that human element is so important. So understand your patient is the first place I would start.
Yeah. So it's interesting. I hit that age where your body doesn't work quite as well as it did when you were much younger. And so I threw my back out a week ago Monday, and I've been having issues with this. So I've been trying to get into healthcare systems, and I've had two experiences. One is I called into my general practitioner trying to get an appointment. I stood on hold for probably about 5 to 10 minutes, got dropped to a voicemail, left a voicemail message. Next morning, I get a phone call to kind of set up a meeting to go see my doctor. So I saw my doctor. I had to go to another person, and basically I went online, hit the scheduling routine. They basically gave me a window of time to do. I got a text message confirming it. And then, like 15, 20 minutes later, I got a phone call from that office confirming the call. Two different experiences. Offices are literally, 10 miles apart, and just a wholly different experience. Do you see that this kind of more self-serve kind of patients doing things more on their own kind of as something that's changing with this industry?
I think you're going to see a lot more adoption of that, again, based on the conditions you're managing. You look at the influx of capital into the healthcare technology space and the players, whether it's Google, Amazon, Microsoft, whether it's CVS buying Aetna, you're seeing a move towards technology driving healthcare decisions. At minimum, technology companies are understanding the consumerization of healthcare, and that the patient wants more access to their provider. Yeah. I mean, if you're a parent and you've got children, you want to be able to get online with your pediatrician. You want to be able to go back and forth, because to take a young child into a pediatric office is very difficult. So a lot of specialties and a lot of practices are somewhere in the middle of that adoption. And I always encourage practices I work with. Patient satisfaction and patient experience are two different things. And you need to understand that, because you can have an experience that was bad, but still be satisfied that the result came out okay. If I went into the urgent care, I had an issue, I was all of a sudden treated, and that was resolved. My satisfaction is good, but the experience could have been poor that I sat in a waiting room forever. So again, we just got to understand that.